Hello, and welcome to my presentation on providing culturally competent care. My name is Amanda Howard, and I am a baccalaureate nursing student with Indiana State University. This presentation is part of a health education program project for Indiana State University's School of Nursing. This program is intended to help educate people, especially nurses, on the importance of providing culturally competent care. After viewing this presentation, you should be able to define cultural competence, state the components of culturally competent care, and identify culturally competent caregiving. Please take this time to pause the presentation and test your knowledge of culturally competent care with the provided 10-question pretest. Cultural competence in healthcare is the ability of providers and organizations to understand and integrate individual values, beliefs, and behaviors about healthcare and well-being into the healthcare process. These values, beliefs, and behaviors are shaped by many factors, such as race, ethnicity, nationality, language, gender, socioeconomic status, physical and mental ability, sexual orientation, and occupation. A culturally competent healthcare system can improve health outcomes and quality of care and can contribute to the elimination of racial and ethnic health disparities. More than 1/3 of the U.S. population consists of individuals from ethnic and racial minority groups. The healthcare needs of these groups of diverse racial and ethnic communities and linguistic groups, each with its own cultural traits and health challenges, can present a problem. Nurses and other healthcare providers must account for these differences through cultural respect to support positive health outcomes. According to the American Nurses Association Code of Ethics for Nurses, the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Taking these unique attributes into account, culturally competent care requires several key components. The first is cultural awareness. The nurse must analyze her own cultural and professional background through in-depth exploration and self-examination, gaining insight into cultural healthcare values and beliefs. The nurse must also expand her cultural knowledge by looking for and gaining information about other cultures and ethnic groups. Her cultural skill with collecting patient data regarding the patient problem and being able to perform a culturally specific assessment. Cultural encounter requires the nurse to engage in cross-cultural interactions with culturally diverse patients as an ongoing process. The nurse must also be motivated to become culturally aware and seek out other culture encounters. She must be willing to respect and accept cultural differences and be willing and open to learn from others. Here are some key tips for the nurse to keep in mind when providing culturally competent care. Don't make assumptions. Patients from other parts of the world might not be as familiar with certain types of diseases seen mostly in the United States. Explain every detail. Patients whose native language is not English may have a difficult time understanding medical jargon. Ask about alternative approaches to healing. Many cultures may use herbal remedies or other alternative treatments that could have a potentially harmful interaction with Western medicine. Withhold judgments. Some cultures place a high value on extended family members who may fill a patient's room, or interdependence instead of independence when it comes to self-care routines such as bathing and eating. Accommodate and educate. Nurses may sometimes be able to teach patients about techniques or technologies that are at a difference with the patient's cultural beliefs, but she should always try to find culturally accommodating alternatives when possible. It is important to remember that cultural competence is an ongoing learning process. It's also important to remember that you can't know everything about any given culture. Cultural competence should be considered as a process rather than an ultimate goal, and it's developed in stages by building on previous knowledge and experience. Please take some time to review the following resources on providing culturally competent healthcare. Please take this time to pause the presentation and retest your knowledge of culturally competent care with the provided 10-question post-test. Thank you for taking the time to view my presentation. I hope you have learned something about providing culturally competent care.